Good morning and welcome to Radio Friends on Friday, November the 13th. It's the first time I realized today is Friday, November the 13th. I hope you're not superstitious, but we have Dr. Anand Chockalingam with us. Good to have you here, Doctor.
Pleasure
Renowned heart specialist. I appreciate the information that you share with us. And today you wanted to talk about the effects of COVID-19 on our heart. What effect is it having?
If you look at how things have progressed, we've learned quite a bit in the last 6 to 8 months that we've had COVID around. And every day we take care of a few COVID patients, and that number has remained sort of steady here in mid-Missouri. But if you look at in national and international trends, I first wanted to highlight what the COVID does to the heart. If you look at it, we initially thought it can increase the risk for heart attacks and need for stents and bypass surgeries, that sort of thing we perceived. Then this is a virus that directly involves the heart. So you will have inflammation, we call it myocarditis. So coronaviral myocarditis is a real thing.
It can cause inflammation in your heart.
It does. And luckily, it does not affect everybody. And some of the people who have COVID may have symptoms that are related to the heart, some may not. Mostly we don't see it. But when we look at 100 COVID patients, if you look at very sophisticated tests, like looking at ECG, beyond that echocardiogram, beyond that we go to cardiac MRI, we will see in better tests that there is some involvement in the heart in up to about half the patients, maybe even more.
And this could have, even after you recover from COVID, if you have it, even after you recover, it could have long-term negative effect on your heart?
That is a question we don't know the answer. We may not know the answer for another 3 to 10 years to wait and see how this has continued to inflame or involve the heart. We are hoping it doesn't leave any residue, but there is a potential that some patients who've been infected with COVID virus may end up with trouble, if not acutely, even years down the road. And do we have any specific tools to prevent it? Unfortunately, at this time point, we don't. So we just hope that this virus clears the system completely and leaves the heart alone.
But it's too early to know, the studies take time to complete, just like a vaccine takes time to develop and be tested to know whether it is safe or not. We were talking about this before we came on and just sharing your opinion. Where do you feel we're going with this?
We have about 3 or 4 vaccines in phase 3 trials right now as of fall 2020. So hopefully in the next 2 to 4 months we should have, I'm hoping, good options for more people to reduce the problems that our society is now facing in the form of COVID.
Explain why it takes so long to develop and test a vaccine.
It usually takes several years. So this process is being as accelerated as potentially possible. And that's why we are even talking about finding some vaccine in the next few months. But it's just a long process to try and weed out the adverse effects of these compounds.
There has to be studies, right?
Yeah. And that's what is already happening.
That's
We're already
happening
doing
now
phase 3
to
studies.
find out if there are any side effects, and then if the side effects are there, are they serious? Are they life-threatening? Before you can release the vaccine to the general population.
So that's what is going on. So as I was talking to you about heart attack, one risk, the other thing is myocarditis. The third thing is an entity we concern. Even last week I saw a patient who has Takotsubo, or stress cardiomyopathy.
What?
It's a type of cardiac heart weakness that happens in other critically ill patients. Because coronaviral infection causes lung failure and hypoxia, we see this type of acute cardiac dysfunction. But that type of heart failure usually resolves within a couple of weeks. So we are seeing a lot of different types of electrical problems, heart muscle weakness, myocarditis, stress cardiomyopathy. All these are the direct effects of the coronavirus on the heart. But another thing I want to leave people thinking about is how the coronavirus pandemic involves heart health. In a actual, if you look at it in a, I would say, broader perspective, I honestly feel this has allowed people to relax in the sense they are not work stressed. They're in big cities, they are not spending 2-3 hours on the road. Traffic stress is not there. And for families, they are getting much more time with their children and the spouses at home. So all this, I think, in some ways has actually reduced the type of modern day stress that mankind has been facing. So 2020, in a way, has reduced stress in some patients. And I feel that may be the reason why, if you look at the same last few months compared to 2019, the ST elevation myocardial infarction, the acute heart attack that we call 911 and get airlifted for, that one actually has come down by about 20 to 30% throughout the US. So we feel there are some benefits. And lastly, I want to leave you with this thought about how much time do we really spend understanding ourselves and reevaluating our priorities. This COVID virus pandemic may be the chance that we didn't ask for, but we got,
Right.
for us to reset our lives. That's what I'm inviting people to really think about, because this is going to pass one way or the other. In the next few months, we are going to get back to speed and do everything that we were used to doing. Hopefully, it will happen sooner than a few months. But once it happens, I'm sincerely urging everybody to use this opportunity, as long as it lasts, to try and find it within yourself, to know truly what your values, goals, and life perspective needs to be.
And relax. The one thing you said, maybe the good point, is that we're not able to do as many things as we used to do in the past. Maybe you can take some of that time and just sit quietly.
Learn to do that, so that
Learn
throughout
to sit quietly.
our lives we can get that benefit, because the world is only getting faster no matter what. Science
Yeah.
is moving us into a much more faster lifestyle
And
than we have.
listen to the sweet music of silence. The sweet music
Definitely.
of silence, and take those deep breaths. And as Dr. Anand Chockalingam always says, smile. It's important to smile.
For the last 15 years, I've been asking patients, what are you grateful about? Now, only in 2020, I'm hearing the answer, Doc, I'm happy to be alive.
Yes,
so that
that's
is because
good.
of the virus.
I'm happy to be alive too. Smile. And I'm also happy to call Dr. Anand Chockalingam a friend of mine. Thank you. Thank you for being
Thanks
with
so
us
much for
today.
having me today.
You're welcome. We're out of time for today. If there's something you'd like to hear or see, I'd love to hear from you. Drop me an email. That's pepperp@missouri.edu. And please wear that mask when you go out. Bye-bye.